Okay, you went to your doctor and you got a prediabetes diagnosis. Let me tell you what that means and why our conventional method of managing is passé. And what we really need to be focusing on is reversing and actually causing remission. And what does that mean? So today I'm going to go over exactly what the um, newest data shows, explain to you why old methods are failing you, and my method that I use in my patients and coaching clients to help them actually achieve remission with prediabetes and type 2 diabetes as well. So, hi, I'm Dr. Jenn. I'm a lifestyle medicine doctor. I practice joyful medicine, where evidence based lifestyle medicine meets you where you are, honoring your culture, your life, and your lived experience. Always joy first and weight inclusive. So, let's get into it. So there was actually a recent study that came out that I'm going to go into in detail. But first, I want to talk about why, when you get the diagnosis of prediabetes, our typical management criteria is actually failing us. So we know from this study that collected data over 20 years from the Diabetes Prevention Project here in the United States, and then from the other diabetes project in China. 30 years of data there that demonstrated that when we do the conventional method of managing diabetes, which means maybe focusing on losing weight, focusing on getting your blood sugars in the normal range, maybe a higher protein and exercising, the typical, eat less, move more, limit your carbs method. What happens is maybe you stay in the pre-diabetes range, but many times it actually gets worse. So maintenance actually ends up not actually maintaining, and I'll talk a little bit about more about why that is. But also, your risk for cardiovascular disease increases significantly. The patients that solely remain in the pre-diabetic range without achieving remission actually have a higher risk of heart attack and stroke and death from cardiovascular disease. So when we talk about the cardiovascular system, we literally mean every vascular, every vein and artery in the body. So all of that vasculature can potentially be damaged from chronic diabetes, chronic elevated blood sugar. And this has takes a toll because we know that it's the time that you are in that state that leads to ongoing damage and ongoing problems for the future. So it's not just the fact that the blood sugar is, out of in the pre-diabetic range and not in the danger range, but this actually chronically causes a problem. So often what happens is when we go to the doctor, we get a diagnosis, it's a short appointment, so not a lot of time to go over the details of exactly what is happening in your body. And we focus on the management because that has been what traditional recommendations lie, from American Diabetes Association and other associations around the world. That has been the typical recommendation. Limit carbohydrates, make sure you're reading your labels, make sure you're moving well. And that is, achieves many times, maintains prediabetes, does not allow progression to diabetes, although in some cases, like I said, it does result in progression to diabetes, but it doesn't address the underlying cause. And that's what we're going to talk about today. So I'm going to talk about the research first. So let's talk about what is going on. Or actually, why don't we talk about what remission is? So first, let's define what remission means. So remission of prediabetes and diabetes means that you have a fasting blood sugar below 100 without medication. And that's the key. And that is the new goal. Because when we talk about that, when we talk about management, what happens is we don't address this underlying cause. So we're not able to get out of this. We constantly have to remain in this management stage. So this landmark um, study, uh, article, I should say, followed the diabetes prevention program, the largest US government study that most clinical guidelines are built on. And it found that these interventions that I mentioned before, limiting carbs, exercising more, losing weight, which the goal was 5 to 7% of body weight, that's the goal, that actually prevented progression to from prediabetes to type 2 diabetes by about 58% over 3 years compared to no intervention at all. So that's good. That's real, that's meaningful. And so cutting carbs can actually lower A1C in the short term. couple things about when you cut carbs. One thing is that it's hard to do, right? So much of our food has carbohydrates in it, and it is hard to maintain for the long term. So what happens is often we go back to our previous pattern of eating. Our brain needs carbohydrates to thrive, which is a discussion for another day. But we go back to our previous way of eating, and that actually results in sometimes regaining weight, but worsening diabetes over time. And that unfortunately can be a problem. Losing weight also can improve insulin sensitivity in the short term. But again, that often is fleeting unless we do an underlying meaningful lifestyle change, which I'll talk about what I mean. And a big thing is when we talk about from this study, they found that the largest A1C reduction with cutting carbohydrates was really in that first 3 months, and it lowered over time. So by the time we continued out, it decreased. And that's because it is hard to maintain over the long term. And when the restriction stops, the numbers increase. So again, the key is that it doesn't address this underlying problem that when you limit your A1C to the prediabetes range, what happens is you progress, unfortunately, to cardiovascular disease because that damage is occurring. But when you achieve remission, meaning your blood sugar is below 100 without medication, people from this study that they touted, so the study from China and the largest American study on the diabetes from the diabetes prevention program, it showed that they had a 58% lower risk of dying from cardiovascular disease. They also had a 42% lower risk of having heart failure. So this is really important. This is from 20 to 30 years of follow-up. So this is real data. It's not, a short-term study. This is really looking at what we're doing now and what the effect is long term. And this is really important because when we talk about cardiovascular disease, we're not only talking about our heart, but we're talking about our brain, our risk of stroke, our risk of kidney disease, our risk of peripheral vascular disease. All of these things are affected by this ongoing elevated blood sugar or the pre-diabetes range, right? So without achieving that remission, we're still it still results in ongoing damage. And this is really important. But with this change, with this goal of the reversal, with this remission, with the number below 100, we see real effects, and that is key. This remission, that effect lasted. So the people that achieved remission, it lasted for decades, this protection. So this is really important. And so this tells us that our goal should be remission. It should not just be better numbers. It's really to really improve our metabolic health. So really getting to that underlying cause and addressing it. And not only that, but choosing a lifestyle change, not a diet, which is what avoiding carbs is. That's a diet, right? That's a short-term solution for a long-term problem. So we really need to address a lifestyle change. And what does that mean? It's really creating a way of life that supports your health overall. And that's what I talk about every single day. I have an online community if you want to join. That's where we go through these things. We do challenges every month. I provide a lot of education. We have supportive meetings at least once a month. And so this is where we work through this. So this is really important, is that approaching this by not just focusing on weight loss or limiting carbs or optimizing your numbers, it really is addressing the underlying cause and improving your metabolism and how you process food. And that's really, really the key. And I think that this is what I think, the second I found out about that it was possible to reverse diabetes, to induce remission, this became my mission. And I am on a mission to help women and families reverse diabetes. And that's why I talk about this all the time. So how do we achieve remission? So this is what I want to say. So a diet alone is not going to achieve it. Focusing on weight loss alone is not going to achieve it. Eliminating carbs is not going to achieve it. Exercise alone is not going to achieve it. It is an overall change that is something that you can do for the long term. And it is step-by-step change. It is consistency over perfection. I say that all the time. Progress over perfection is the key, because those small, consistent steps are what are going to get you there. And so what do I do? So there's several things that often aren't conventionally talked about. So I'm not going to talk about food first. The first thing I'm going to talk about is actually our nervous system. And I think that that's really something that's overlooked in so many cases. And I will say a recent study came out about the effect of stress on African American women and how it results, African Americans in general, but it results in a shorter lifespan. And this is really important. We know study after study after study shows that stress has an effect on our ability to control diabetes, our risk of dementia, our risk of, so many things. And when we don't address stress, when we do address stress, we're able to achieve a lasting lifestyle change. We are able to lower our cortisol, which is the main, contributor to the worsening of these things. We're able to lower our risk of heart disease and stroke and all of these things, and we don't address it enough. So nervous system regulation, I will say our cortisol results in elevated glucose, right? Because if we are stressed, our body thinks that we need that energy to fight the bear or deal with whatever it is. It treats all stress the same. So by elevating our cortisol, which results in releasing glucose from the liver, which elevates our blood sugar, right? And so we can eat well. We can move our bodies. We can, avoid carbs, and our glucose can still elevate. And so this is a really important thing. So addressing stress is is primary, I think. And I look at it as joy. Joy is one way that we can manage stress. When we embody joy, even if it's just for a moment, any of these little moments, I call them savoring moments, when we can do these little micro moments of joy, it helps regulate our nervous system. It helps lower our cortisol. It helps stimulate our vagus nerve and stimulate our parasympathetic system. All of those healing systems that need to be stimulated, that need to be engaged in order for us to heal, in order for us to be able to better manage our blood sugar, to lower our risk of chronic disease, to lower inflammation. It's really important. So the first one is the stress. Second is sleep. That's another one that we often think, oh, I'll catch up on it later. But sleep is another stressor. It independently elevates glucose, right? It's going to also elevate our cortisol. It is going to affect our hunger hormones. It's going to affect our ability to feel satisfied when we eat, and also our hunger later during the day. They showed that 4 nights of partial sleep deprivation can um, reduce insulin sensitivity in people that do not have diabetes by 30%. So this is really important. So even people that do not have diabetes, that have sleep deprivation chronically, can, even 4 days, that's not even chronically, 4 nights can result in elevated, reduced insulin sensitivity. So think about it. If you have diabetes or prediabetes, what that chronic sleep deprivation is doing to you, it's really important. And for women in menopause, this is a double whammy, right? Because we already, have reduced insulin sensitivity related to menopause, and increased abdominal fat related to menopause, and we have sleep disturbance related to menopause. So it's even more important for us to try to protect our sleep, to honor that sleep is important, and that um, often we feel that we have to take care of everybody else and we don't take care of ourselves enough. We have to kind of let go of some of that and really prioritize ourselves. It's a really important time of life for us to do that. The third one is our gut health. So nobody talks about gut health when they talk about diabetes, but gut health is vitally important. We have our own natural GLP-1 system. Our natural GLP-1 system is suppressed by stress and lack of sleep, those two things I discussed before, but it's enhanced by a healthy gut. And so our microbiome, which when I talk to the kids about this all the time, I say, you have this army of microbes on your body. We are outnumbered, human cells to microbes. So there are more microbes on our body than there are human cells. And that little army can either be with us or against us. And so when it's with us, we produce more GLP-1. We have better digestion. We have lower stress because our happy hormones are more able to circulate, or produce more of them. So we cannot ignore our gut health. And what feeds our gut? Those high carbohydrate foods that you've been avoiding. So high carbohydrate foods, meaning fruits and vegetables, whole grains, beans and legumes, nuts and seeds. All of these foods have carbohydrates in them, and they are nourishing to our gut. That variety of plant foods acts as, fertilizer for our microbes in our gut. It increases the diversity, increases their health, helps them stay around longer. So this is really important. And that is their signals for our gut. And so those are the main components. So eating the rainbow of fruits and veggies, monitoring your stress, sleeping well, these are the main levers. And then moving your body. Obviously movement is important. We are animals, we are meant to move. If you look at, historically or ancient times, we walked 3 to 5 miles a day. And, our current life, like me sitting here in this chair, we spend a lot of time sitting, we like spend a lot of time connected to technology, not enough time in nature, which is another lever that we can use, but also just moving our bodies. So, moving our bodies, walking after meals, even a 10-minute walk after meals could help control your blood sugar. But let's just talk about this. I just want to be clear. So, when we talk about addressing this prediabetes, we want to again get to the underlying cause. So that means reversing insulin resistance. These things that I spoke about, those are where we can actually reverse insulin resistance, help our body respond better to the food that we eat, and get to that point where we are in remission, where our blood sugar is less than 100 without medication, which is the goal. So, it was a lot of information, I know, but I can't ignore this study. So this just came out in February, and I think that there's not enough discussion about it because we need to move beyond this management. And so if this is resonated with you, if you've been recently diagnosed with prediabetes or you have had prediabetes for years, this is something maybe to bring up with your physician. If you're looking for a different solution, I do have a coaching program, a 12-week coaching program called the Joyful Metabolic Reset, and it is helps women reverse prediabetes and diabetes. I've helped many women actually achieve this goal, come off medication, avoid medication, and really just feel better in their bodies and have a way to move forward that is not a diet. It is a lifestyle change that takes time, but it is really worthwhile, as you can see, because achieving remission is really where we should all be going. So thank you for watching. All of the descriptions of things I mentioned in this video, I have a free fiber guide, my community, and a Joyful Metabolic Reset. Those are all in the links are in the description. So again, join me every Friday morning at 9 a.m. I'm always here live. You can share your questions. I am happy to answer them along the way, or I will answer them after. So thanks for watching.